En el campo donde vivimos nosotros, la comunidad muy alejana, donde está la pobreza. En primer lugar, la emergencia. Tengo que salir de mi casa a 1 hora, llamar y decirle al médico del hospital: tenemos este problema en la comunidad, que necesitamos que los ayuden. Mandar al comité de transporte a sacarla de 1 hora a la carretera 2 horas, ¿verdad? Entonces la ambulancia, fuerza que tiene que llevarse mínimo 1 hora y media, 2 horas de aquí a Matiguá.
In Nicaragua, the most vulnerable people suffer more death and disease simply because they are poor and they have difficulty accessing health care. In rural communities, women and children still die of common health conditions and diseases that we can prevent and that we can treat.
That's why we established Amos Health and Hope, with the goal of serving alongside rural communities so that they can help improve their own health. When health professionals, government, and people in rural communities come together, we can accomplish great things. At Amos, our values challenge us to reach out to those in need, believing that we can change the world by working together. Amos Health and Hope stands for a ministry of sharing health and hope, and the name is also inspired by the prophet Amos in the Old Testament of the Bible. Amos was a farmer who spoke out against the injustices of his time. His message about justice flowing everywhere is still relevant today. We work with a commitment to serve alongside those most in need, to live out our values of love and solidarity in action, and to celebrate with local leaders as they work towards bringing about peace, justice, and health to their communities.
Because there are no doctors in the most remote parts of Nicaragua, we share our knowledge. Because healthcare is far away, we share our resources. And because health is more than just being physically sick or not, we share our love. The first thing that we do when we're invited by a community is that we listen. Building sustainable change over time to build true partnerships starts with listening. We listen to the knowledge and insight of the community, starting with their strengths and what resources they already have. People choose leaders from their own communities to be health promoters and build a system of improving health for the people and by the people.
Ser promotor de salud es algo especial que Dios los ha regalado. Hemos logrado, por medio de la organización comunitaria, para poder alcanzar esto. Nosotros, comité, promotor, AMO, que es un organismo que mira por las dificultades de toda la comunidad.
We come alongside communities so they can determine their own priorities, and then we work with them to come up with ways to address these priorities. After we listen, we learn and reflect together. We collect data with the community so we can learn about their most relevant health problems, and we reflect together on what steps can be taken with the new knowledge we all have. We are not doing research on or for a community. It's a partnership with the community, so we are constantly evaluating and thinking critically together about the best way to improve health in the unique context of each community. After learning and reflecting, we're ready to take action.
We help communities to become empowered to take action to improve their own health. Empowerment must be more than a buzzword, and here at Amos, it is at the center of all we do. The people who have been chosen by their own communities, the community health workers such as health promoters, health committee members, and volunteer mothers, must be the ones to lead because they can be the most effective at promoting long and lasting change from within. We take action by coming alongside the community health workers to get proven, simple methodologies and technologies to the people who need them the most. The unjust conditions of poverty are complex and cannot be changed overnight. And this is why our partnerships with the local government health department, universities, communities, and volunteers, all working together, is crucial to the success of our programs. It takes all of us working together to make change happen.
By listening, reflecting, and taking action together, we have been able to make a real difference by working alongside people in communities across Nicaragua. The impact we see is more life than death. Pregnant moms have less chance of dying during childbirth because of frequent home visits and planning. Children are healthier because parents are being educated about proper hygiene and nutrition. And children aren't dying from preventable or treatable illnesses like pneumonia and diarrhea anymore because they are being diagnosed and treated quickly.
Amos has always been about bringing people and communities together. Churches, people of faith, universities, and individual volunteers have been instrumental every step of the way. This work has only been possible because of what we have all contributed over the years. We train others interested in carrying out work in global health with humility and integrity, and we offer experiences that give people the opportunity to explore the question, what does it mean to live out a commitment to seek greater justice in our world?
So how does Amos try to live out community-based participatory research principles here in Nicaragua? For us, it's about being in relationship, about listening, reflecting, and then taking action together. It's about doing this for the long haul, all of us together, to work towards social justice and the dream of health for all.